And with that, I am going to turn it back over to Megan for our final session with Rose Horton, and she's going to reflect on today's discussions and then explore how we can turn these insights into action moving forward. Megan?
Yes, thank you, Sarah. Thank you, Becky and Aubrey. I know we all go way back, and that was just a perfect example of cross-collaborative work and partnership with the goal to improve outcomes. And the fact that you do this work that you do is just our hearts go out to you. So thank you. So as we come to the final session of our symposium, it is my privilege and honor to introduce you to our closing speaker, Rose Horton. Rose has been a tireless advocate and leader in maternal and child health, bringing years of experience in policy, program development, and community engagement. She has a unique ability to translate complex data and insights into actionable strategies that make a real difference in the lives of families. So this session, titled From Insights to Impacts, Where Do We Go From Here?, will guide us in reflecting on what we've learned over the past 2 days and exploring the next steps for advancing maternal and infant and fetal health. Rose will challenge us to think about how we can turn knowledge into action and continue building meaningful, lasting change. So as we're all virtual, please again and join me in giving Rose a warm virtual welcome. And Rose, if we can unmute you, I think you should be good to go.
That sounds great. Can you hear me okay?
Yes, yep.
Perfect. And if you will advance the slides for me. Thank you so much for having me on. I was delighted to have been able to join halfway through today to hear some of the amazing insights. And I love everything that I've heard. And thank you, Megan and your team, for hosting this. So if you can go to the CDC slide for me, please. So this slide really speaks to the fact of why we're here. This data is from 2023, and it's CDC doing a survey. And what you'll see is that 1 in 5 women reported experiencing mistreatment during childbirth. And if you disaggregate the data, 1 in 3 women experience mistreatment. And the 45% is the one that I always say to my nursing colleagues gives me pause, because 45% of those who were surveyed said that if they had a concern, they wouldn't necessarily share that with the clinicians and with the hospital staff. And that really gives me pause. And I think it was Dr. Story who spoke to the historical mistrust that some birthing people have of the healthcare organization. Also to discuss how very busy, how very fragmented some of our work is, and how there's a fear of retaliation or fear of not being heard. So this is why we're having all of these conversations, because we need to change this for the birthing community. If you go to the next slide, this graphic I found on the internet during the pandemic. As we consider what our roles can be as the birthing community, I think we need to consider that we can all be an ally. I have 2 definitions here because I've done some work around the concept of what is an ally versus what is an accomplice. So the first definition is the definition of an ally: an active, consistent, and arduous practice of unlearning and re-evaluating in which a person in a position of privilege and power seeks to operate in solidarity with a marginalized group. As I look at that graphic, for many, many years, a lot of the advocacy around mitigating maternal and infant morbidity and mortality has been really borne by marginalized communities. You know, the Black and Brown communities are doing the hard work. And I think the graphic really speaks well. I know it speaks true for me that, you know, we're tired and we need more people to lend their voice in the work. So the choice is yours. Do you want to be an ally? There's room for everyone. Do you want to be an ally, or do you want to be an accomplice? I think the accomplice takes it a step further. So the accomplice is the person who uses their privilege to challenge existing conditions at the risk, right? So this takes us totally out of our comfort level, at the risk of our comfort and well-being. So how can you leverage the privilege you have? And that varies for everyone who is listening to this webinar. How can you leverage your privilege in an effort that you can save lives? Because we're not just talking about doing a good thing, we're talking about life-saving things. If we go to the next slide, I really love this. What else do we really need to see more of? We need to see more shared decision-making. One of my passions and goals is really to dismantle the hierarchy that we've created in healthcare. The hierarchy we've created is that the most important voice in healthcare and even in childbirth is really not the patient, but it's like the providers and then everybody else, and the patient is lost in the shuffle. There is really a need, and I've seen a really wonderful transition to shared decision making. But as we want to have greater impact, this needs to become the norm. Shared decision making. I love the graphic from Birthplace Lab. It gives us really such great information. And I say to nurses that I've worked with and in nursing conferences where I get to be a speaker, I say to them, how can you center the voice and the choice of the patient? And a really great way to do that is to make sure that we are informing them of every possibility, right? I give the example of a family who may want, a birthing person who may want an unmedicated birth. If they show up to the hospital and they have all their things, they have their birthing ball, they have their aromatherapy, they have their teas, they have their lights, they have all their things, and they really want an unmedicated birth. Our job as the hospital, and they may have a doula with them, which would be fantastic, but our job is to tell them what all the options are. It's not about an epidural versus not an epidural. It's much more than that. It's like you can get up, you can ambulate, you can use, we have wireless monitors, you can use the peanut ball, you can hop in the shower, you can hop in the tub. We have nitrous oxide. What are all the options so that that birthing person can make that informed decision and feel seen and feel empowered and feel heard? That's super important. If you go to the next slide, what you'll see there, it's from the fourth trimester project, which is so great. I loved everything that was shared about the fourth trimester. That's been my jam for a couple of years. But look at this quote, y'all. It says that the fourth trimester to pregnancy, there is a fourth trimester to pregnancy, and we neglect it to our peril. It is a transitional period of 3 months after the birth, when many women are highly vulnerable and experience confusion and despair. This was from 1975, this quote. So this has been around, the concept has been around for some time, but it's been gaining traction the past 3 years. The picture that I'm using as we consider the fourth trimester, and the fourth trimester is the period that I've been most concerned with because I've always worked in the hospital, and I know that not only is this the most vulnerable time for the birthing person and the woman, but it's also the time where there's not as many touch points with the hospital, which is where the community really stands in the gap, where the postpartum doula, where the lactation specialists, where the peers come in, to where the aunties, where the family members really come in to have a significant impact. This picture that I use from Chocolate Milk Mommies, I love it so much because as we're marketing and promoting all of the things to all of the communities, but especially the minorities, we need to ensure that what we're using as marketing, the images that we're using, reflects the patient population. And as we think about breastfeeding, human milk,
Oh, Rose, you cut out for just a minute. Are you still there?
This is what we can do. Yes. Can you hear me?
Yep, now that's better.
Okay, all right. I'm so sorry, guys. It's a lot, but we're gonna make this work. All right, let's go to the next slide. Yay, thank you. Let's go to the next slide, please. this is from the fourth trimester project, and I really love this slide, and I love everything that I love about this slide is that it shows how really complex the postpartum period is. It's not about just one thing. If you start at 12 o'clock, we need to look at mood and emotional well-being, right? And if the woman or the birthing person has been diagnosed with, if they have a diagnosis of depression or bipolar or anything that occurred during pregnancy, we need to make sure that we continue to take medications. We need to ensure that we do the Edinburgh survey to assess women. I think best practice is that you do it 3 times during pregnancy and that you do it just as often in the fourth trimester, right? So look at the mood and emotional well-being. And then we need to look at the infant. How are we ensuring that breastfeeding is working? If there's a decision to use formula, are we helping to ensure that formula is mixed well? Are we providing information about really good
Oh, she cut out again. We wouldn't be a technology conference, right? Rose, can you hear me? Rose? We'll just keep going to hers. So Rose, you come in when you're ready, but basically I talked to Rose before we had this conversation when I asked her to join, and she really, like she said earlier, really wanted to lean into those needs of the fourth trimester and what that is. And I think that really goes together with this conversation today of collaboration and community and building that trust. And so I think as we lean into that part of this conversation and those insights that we've gathered and gotten from the last, what is it, 7 hours, I think that that's really how we go about this and what our next steps is what we learned today and all the partnerships you met and all the new organizations and the people and where you can bridge that gap with the care that you're doing with the people you serve. Rose, are you there? I'll keep trying, Rose. So Rose also added this quote where she says, with this quote that she loves, "I have come to the frightening conclusion that I am the decisive element. It is my personal approach that creates the climate. It is my daily mood that makes the weather. I possess tremendous power to make life miserable or joyous. I can be a tool of torture or an instrument of inspiration. I can humiliate or humor, hurt or heal in all situations. It is my response that decides whether a crisis is escalated or de-escalated, and a person is humanized or dehumanized." So I apologize for the technical difficulties, and I think I will remind you all that I said at the very beginning, we might have technical difficulties and we just go on. We just keep moving, right? I know that Rose was traveling because she is just an amazing traveler and wonderful person. And we're so thankful that she's on our board. And I know that we'll share these slides with you all and be sure to make sure that you have all of this information at your fingertips, that you have the tools and partnerships and passions to make this lasting impact. And so as we close this year's symposium, I really do want to take a moment and thank you all for the speakers and the panelists and the moderators and your participation, the attendees, your engagement, your questions, and your dedication. Over 500 people signed up for this. That means that there's impact to be had. You all are doing amazing work, and we just need to work together to do that. So we want to carry these ideas and strategies and connections from this symposium into our work every single day. Together, we know we can continue to improve outcomes for families and ensure every baby has a chance to celebrate a healthy birthday. So what's next? Obviously, you guys will get an email with lots of great information. You'll get access to the recording, access to the slides. We will make sure you have all of that. Give us a week or two to get that out, and we will send that to you. We will also send out, remember Des Moines University will send out their certificate. If we didn't get to your question today, we captured all the questions, and we will make sure that all the speakers answer the appropriate questions if we did miss one today. We also want to, again, extend a special thank you to our presenting sponsor, WellPoint, for their incredible support in making this symposium possible. Your commitment to improving maternal and child health is making a real difference, as well as our additional sponsors today, some of which spoke today, which is amazing. I love that. I love that collaboration right there. And of course, thank you so much for attending. You can scan this QR code to evaluate the program today. You can also, when you close out of the webinar, you might be given a option to fill out the evaluation. But anyways, we hope you have an amazing day, have an amazing Halloween if you're going out trick-or-treating, and we will be in touch shortly. Thank you, everybody.